Hello and welcome to this week's billing and reimbursement session. This week we're going to talk about workers' compensation. And this is health insurance or health coverage that is different than other types of other types of insurance, because with other insurance you have the beneficiary, the individual applies for it or agrees to it, whereas workers' compensation is mandated by the Department of Labor, and it is done in conjunction with the employer. The employer is required to pay for it under certain circumstances. So let's talk about exactly what it covers, okay? Workers' compensation insurance covers only illness or injury, harm to a person, an employee, while they are on the job. And I say on the job because this is not specific to a location. In other words, if a person is the delivery driver, so they drive from the warehouse to the customer, and something happens, they get into a car accident and they're harmed, that is still covered under workers' compensation, because the only reason they were driving on that street at that time was for their job. Okay, so they didn't have to be in the warehouse or in the office, but they had to be completing a task required by their job. Okay, also notice that this says illness as well as injury. A lot of people can think about workers' compensation and they think about broken arms or legs or something like that. However, there are environmental illnesses, such as if there's asbestos in the ceiling or in the walls of the office and people get sick from that. That would be covered under workers' compensation. Now, it is important for you as the future billers to understand how the claims process works, and we're going to go over this. But I also want to tell you something, as individuals, as employees, okay? And that is that you need to understand that there are some employers who illegally try to convince their employee not to file a workers' compensation claim. And that is wrong, wrong, very wrong. Why do they do that? Because for every claim that's filed from their business, they have to pay more into the workers' compensation fund. Okay? So they're trying to keep their claims down, but that's wrong. If this is legitimate on the job harm, then workers' compensation should be filed. So now let's get into it. As I said, there is federal information about this in workers' compensation programs, which are usually handled by individual states. But you can see here in the first, well, really 3 bullets on the right-hand side of your screen, wage replacement benefits. So if the injury or the illness causes the person to not be able to go to work, they can still get a portion of their salary or their income because of the connection. Okay. Of course, medical treatment is covered just like regular health insurance, and vocational rehabilitation if that is necessary. So, for example, if if the injury or the illness prevents the individual from going back to do the job that they have always done, then workers' compensation will help them get retrained for a different job. Okay. And that's very good. Nobody wants to sit around like a beached whale on a couch. Okay. You want to be a productive member of society. So this is all covered along with other things, and that is going to depend on who, what, where, when, why, and how. But the important thing that you understand is this is a federal program. Okay. All right. Now, in the state of South Carolina, Workers' Compensation Commission, WCC, and the reason I put that is if you will notice, that is in the URL, the address for the website, WCC, Workers' Compensation Commission .sc for South Carolina, .gov for government. Okay. And so again, the workers' compensation, even though it's kind of like Medicare, Medicaid, that it's a program created, mandated by the federal government, but it is state administered. So it is very important that the claims align with the state. Now, I can't answer this question, but I'm going to give you the question because you might need to ask the question, which is, let's say this person is employed by a company in South Carolina and they travel to Tennessee for their job, for business, and get hurt while they're in Tennessee. Where is the workers' compensation claimed? And actually, the answer is going to be South Carolina because that's where the employer is. That's where the policy is, if you will. And even though the individual was in Tennessee, they were in Tennessee for South Carolina business. Okay? So again, these are questions you still need asked and answered in order to do your job creating and submitting the claim accurately. Okay, now, one of the things that you need to also confirm is coverage. And why? Because there are certain job positions that can be exempt from workers' comp coverage. Okay. First of all, the number of employees in the whole entire organization is one qualifier. Second, the owner of the business may be exempt. There might be other C-suite or executives who have been claimed as exempt. So before you submit the claim, you need to find out what this individual's coverage is for workers' compensation. Now, are you going to ask me? See, you forgot that I am telepathic. You're going to ask me, well, what if the person is not covered under South Carolina workers' comp? What do we do then? What do you do then? You file the claim with the individual's regular health care insurance coverage. Okay. All right. Also on that South Carolina website, you can find this page for claim forms, and you will notice that the third item down is health insurance claim form. But you can't really skip over first report of injury, which needs to be filed by the employer. Okay. Also, there is going to be a need for line 4, form 14B as in boy, physician statement, where the physician is going to state clearly the illness or the injury and the fact that this employee can go back to work in 6 weeks, this employee can go back to work never, whatever it might be. And to give you a little glimpse, oh, I thought I had a copy of it. Okay. So you can see how you can download this in a PDF or a Word document. And this is important. And again, just like I have been doing for the last several weeks, I am not giving you these details because A, the details are going to depend on the situation, the patient, like that, okay? But I also am not going to expect you to remember this little thing for a year and a half from now when you're working and you might have to file a claim for workers' comp for the injuries for your patient so that your facility can be reimbursed. What I want you to do is write down and remember where to go for the information, especially because whatever information I give you now that might be current may not be current a year and a half from now. You always have to go to the source and get the right, correct information that is current. If you file a form that they used to use 2 years ago, 5 years ago, all you're going to be met with is rejections and denials. This is not going to work. So also on the WCC South Carolina website, you will see the link for medical provider, and this is going to be you. You are working for the medical provider. You are part of the provider team, and you will see that FAQs are always good. You can see medical bill dispute resolution process. So if you file a claim and it is denied, you go, wait a minute, what? Huh? You can dispute that and don't let that go unpaid. Okay. And then of course on the right hand side, the third box down, you see the medical fee schedule, which, like with all third-party payers, they publish exactly how much you're going to get paid for every CPT code. So, or ICD-10 PCS code if you're in a hospital. So whatever it is, the fact is it's your job to know. It's your job to have current information and using your resources such as the South Carolina website. Okay. And if after you graduate, you move to a different state, just Google it. Google workers' compensation for whatever state that is. And then you will have that information. Do not assume anything. We're not in that job. When it comes to healthcare, we never assume. Okay, so talking about assuming, remember safiansc@cctech.edu is my email address if you want to conversate with me. If you have a question, if you're unsure about anything, this is, I love it when students email me and ask me questions. If you use that other email address, it is going to go to the third ring of Saturn and I will never see it. Okay? So please, please, please ask me questions when you have them. I super duper love that. And other than that, have a happy, happy day. For those of us, those of you who celebrate Passover, happy Passover. All right. Have a wonderful, wonderful day and week. Bye.